afternoon. I would like to welcome you to this Welcoming Interactive 2021 session titled The Importance of COVID Community Champions. Before we begin, I would like to thank Walmart and Western Union for their sponsorship of the interactive. My name is George Zavala, and I'm the Western Regional Manager at Welcoming America. It's a pleasure to moderate today's discussion. I would like to review some housekeeping items. If you have any questions, please enter them in the chat area on your screen. Our staff will respond to any technical questions, and we will do our best to respond to all content-related questions during the Q&A portion of the session. We invite you to engage on social media during the session using the hashtag Interactive2021. Share that you are attending the interactive and any content that those in your social networks may find helpful and inspirational. Some context for today's session. From May to December 2020, Welcoming America hosted an inclusive emergency management community of practice in response to the COVID-19 pandemic. Participants included Welcoming Network members and local emergency management practitioners. Feedback from the community of practice indicated a need for a tool that community-based organizations, city and county governments, and emergency management practitioners could use to institutionalize inclusive policies and practices beyond the pandemic. The result is our establishing and maintaining inclusive emergency management with immigrant and refugee populations checklist. I will share a brief overview of the sections within the tool that contextualize the conversation we will have with our panelists and how it relates back to the importance of COVID community champions. So what is inclusive emergency management and who are COVID champions? Inclusive emergency management requires that emergency planning, response, and recovery efforts consider the unique needs of a community's diverse residents, including immigrant and refugee residents. It prioritizes community involvement in the design and implementation of emergency response. Ultimately, communities invest in inclusive emergency management to reduce risk and improve resilience. COVID champions are individuals who help disseminate information on public health and safety, prevent the spread and negative impacts of COVID in their communities, and use their personal experiences to build trust with immigrant and refugee communities. A COVID champion can range from staff in general departments, in government departments, nonprofits, to local community members and volunteers. 3 of the 5 guiding categories within our tool outline the important role that COVID champions have played in this pandemic and will play in future emergency disasters. Our speakers today will share how their organizations, roles, and personal experiences shape community assessment efforts, trust building with immigrant and refugee communities, and inform inclusive communication strategies. It's my honor to introduce our distinguished panelists. I'm grateful that each individual has taken the time to share their experience and how it relates to our topic of COVID community champions. Our first speaker is Dr. Janine Abrams-McLean. Dr. Abrams-McLean is the Vice President at Fair Count, a nonprofit, nonpartisan organization founded by Stacey Abrams. Janine is a highly skilled researcher with over 15 years of experience in designing, managing, and implementing population-based studies and projects. While at the Centers for Disease Control and Prevention, she applied her expertise in computational biology and population research to advance public health initiatives. In addition to her work in public health, she is passionate about finding creative ways to tackle community-based issues using both strategic planning and innovative ideas. Next is Shun Tucker Allen. Shun currently serves as the Faith Coordinator for Fair Count. She is a proud native of Atlanta, Georgia. After more than 14 years as an independent contractor, she joined the Stacey Abrams for Governor team as the political coordinator, where she worked with faith leaders throughout Georgia. Following the campaign, she continued her faith-based organizing work for several initiatives. Her organizing approach is an incorporation of her faith-based strategies and experience, along with a strong passion for helping others. She is especially focused on rural and underserved communities. Shun received a bachelor's degree in political science with a minor in religious studies. She also holds a master's degree in public safety with a specialization in emergency management. Imam Sheikh Wazir is the CEO and founder of African and Immigrant Communities of America, Inc. Imam Wazir was born in east part of Ethiopia and received a BA in sociology. He worked for the American Embassy in Rome, Italy for 3 years and for 10 years as a social worker with the Washington state government. In Georgia, Imam Wazir worked for the International Rescue Committee as senior case manager and also as the director of refugee resettlement for Africa Community and Refugee Center. Imam frequently travels nationally and internationally, teaching tolerance, peaceful coexistence, and officiating and offering marriage services for about 100 people per year. Finally, we have Erin Mann. Erin is the program manager and co-principal investigator for the National Resource Center for Refugees, Immigrants, and Migrants, also known as NRC-RIM. Erin also serves as the Global Collaborations Coordinator for the Center for Global Health and Social Responsibility at the University of Minnesota, where she manages a partnership between the University of Minnesota, the International Organization for Migration, and the CDC. Prior to these roles, Erin has managed global health and public health projects related to public health emergency preparedness and response, global medical supply chains, and biosurveillance. Erin received her master's in public health from Boston University. Each speaker will now share some information about their organizations with you. I'm going to turn the screen sharing off momentarily so that they can present. So Dr. Abrams, McLean, and Shun, if you'd like to present on Fair Count.
Definitely. Thank you so much, George. It's a pleasure to be here today. I'm Dr. Janine Abrams McLean, Vice President at Fair Count, and I'm joined by our faith coordinator, Shun Tucker Allen. So Fair Count, we are a nonpartisan nonprofit organization, and our ultimate goal is to make sure that we do long-term power building in communities that have been underrepresented, marginalized, and disenfranchised. And we do that through continued civic engagement, every iteration of it. So we started with the census, and we did deep dive organizing in communities to make sure that they were counted. We then moved into voting to make sure that the vote share of communities, the vote share gap in communities that have been disenfranchised. We worked to shrink that in Georgia and across the South and other states. And then we're getting ready to move into redistricting to make sure that the lines are drawn fairly. And throughout all of this, we've done it during a pandemic. And one of the things that we know is that the same communities that are undercounted in the census, that are disenfranchised when it comes to voting, and those that have their communities split up and their power diluted, those are the same communities that are being under-resourced during this pandemic. And so at our very core, we are committed to equity and equity in power, equity in resources. And so we've over the past year, we launched 2 programs to really address issues associated with COVID-19. One is our Pandemic to Prosperity South, which is a quarterly report that looks at numerous indicators associated with the pandemic that not only identify the challenges that Southern states and communities face, but also some of the unique opportunities that our communities face to prosper as we come out of the pandemic. And then more recently, we launched in partnership with a sister organization, the Southern Economic Advancement Project. We launched our Count Me In program. And this is really a program that focuses on making sure that communities have equitable access to vaccines and also vaccine information. And so we are just very honored to be here today and are looking forward to the discussion.
So George, thank you so much. What I will say is just everything Janine said. I mean, that's so much of it, but on the faith end, absolutely taking all of those things that she said and really just transferring them and taking them down to the faith community and just organizing and certainly just continuing to, like she said, just consider everyone, every community. I also want to say this is the third time that we have partnered with Welcoming America to really push out our efforts. So we are always grateful to you all, and thank you so much for having us today. And I think Janine really articulated where we are. Just grateful to be here. Thank you.
Thank you both so much. We really appreciate you being here, and we're really excited for the conversation that we'll be having right now. So next, I would like to turn it over to Imam Wazir to share more about his organization.
George, again for the invitation, and I will quickly go over some of the crisis management. I'm considering this like as a crisis management to deal with the problem of pandemic. So we got to have a systematically deal with this problem. It is a crisis, this pandemic, to identify the source and an outline action plan is needed. So when you have a crisis, you can define it as what it is in terms of health, in terms of work, all overall. So the definition between crisis and management, you got to sort of map it up to identify what needs to take place. So it is clearly important to get the definition to the point and then see what is the immediate threat, what is the next threat, and what can we do. And instead of saying, now what? Be proactive or reactive. A lot of problems that we see exhibited as reaction. No, we need to be proactive. Instead of saying what next and what happened, then what need to be done is from the expert in terms of planning, in terms of performing it, break it down to the point it will not be out of hand. One thing that we learned in terms of identifying when this pandemic hit us, we were in a state of denial. We were not prepared. We were not prepared at all. So when this happened, and a lot of people got sick, a lot of people got killed, now the attention of the people start to see. Once we identify, now what do we do? The planning session, the stay home order, the stay home order. The stay home order doing what? We did not study. Staying home, it has its own pros and cons. So we as a community, we as a people, we were not prepared. So learning that to do it better, plan it well, then we start to recovering from that shock. When we start to recover, then we start to manage the crisis. So when crisis happens, the first thing you do what? If something exploded or fire, first you save your life. Then you come back to the data, what went right, what went wrong. So once we feed the problem to mitigate, what is the mitigation that are needed immediately? And what is the next plan we need to do? Who should be in charge of what? Who should communicate to the public, to the school? So now in your city, if you are housing 500,000 children at home versus school, what resources have we given to the parent to deal with these problems? How did they do their homework? What about the donors fatigue? Who pays the bill? In terms of the government, okay, you stay home, we pay you. What about those laborers that has to work on the road or on the street or driving the cab or whatever it is? So all those help. It helped like one-time shot. When Trump was there, he sent a check for a time. Okay, that pays. What about the next month? What about the third month? That problem did not evaporate and run. So we need to have enough planning, and I'm going to talk about it more in detail as a teamwork. Part of this crisis what helped us is to come with in AIC, in my organization, with our limited resources, we have to do nothing but cooperate with each other. We reach out to IRC reach to us. We reach out to our city government, to her honorable Madam Beverly, great mayor of our city. She open-handed and providing us everything we asked for that's legally available, to the point not too long ago she shared from FEMA very important information about funeral services for COVID-related expenses, and many examples. We are in touch with our county government, with our, to recover from this pandemic so that we can get to the bottom of these problems. So I know the slide will be available to you. I'm not here to lecture on every segment, but just to give you an overview of the challenge that we are facing. It is not a joke. We're talking about half of our breadwinning or productive citizens of our country lost it. It's very hard to get them back. And there are some line who might be facing serious death threat due to this pandemic. So we as a community, we need to do more. We need to come together to defeat this invisible enemy, to do better for better tomorrow, a bright future for America and the world. And if I need to come back, I'll come back to it and we'll go through more details. This is to give you an overview of what my organization is trying to do. Is number one is educate, empowerment of education. Education is important like it's food. Education is important like air we breathe. So try to empower education. We try to provide the resources, the resources available to the community so that the community will have the tools to fight this pandemic and recover from this. This crisis generated a lot of problems. It generated a lot of opportunity, yes. It also generated a lot of problems. We have death, we have suicide going up, we have divorce rate going up, we have unemployment going up, we have eviction is going up. We have a list of problems. No one single organization, no one single government agency, no one city alone do. We need to do it together to fight this together. Thank you.
Thank you, Imam. So next, I will hand it over to Aaron to share more about NRC RIM.
Wonderful. Thanks, George. And thanks again for having me. I'm really excited to be here and share a little bit about the work that we're doing here at the National Resource Center for Refugees, Immigrants, and Migrants. Next slide, please. So just a little bit of background about who we are. We're funded by the CDC and our project kicked off in October of 2020. Our focus is around COVID-19 response across the board, whether it's prevention, contact tracing, or mitigation, with the goal of really supporting health departments as well as community-based organizations who are working with refugees, immigrants, and migrants during COVID-19. And through that, our hope is that we're developing and supporting partnerships between those health departments and communities. And even though our resources are primarily developed for health departments and also for CBOs, everything we have on our website is open and free to everyone. So whether it's our guides or our translated materials, we hope that lots of folks across the board will find use in what we've put together. Next slide, please. Just a little bit about our partnerships. So NRC RIM is housed here at the University of Minnesota, but we're really fortunate to have a fantastic group of partners that really help us to do the bulk of the work. So our partners include the International Rescue Committee. So we've been able to work with Imam Wazir through that connection. Also the Migrant Clinicians Network, the Minnesota Department of Health, the National Association of County and City Health Officials, and then we have a new partnership with IDEO.org, who's a nonprofit design studio that's been helping with some of our health communications materials. Next slide, please. Just a quick bit about our core activities. So The first thing that we do, as you can guess based on the name, is to create resources. So that includes toolkits, promising practices, checklists, guides, a lot of resources that we're hoping are particularly practical and useful for both health departments and CBOs. We also have a lot of work in health communications, so looking to fill some gaps, particularly around culturally and linguistically appropriate health communications materials for refugees, immigrants, and migrants. So we have a lot of translated materials, particularly translated materials that are customizable, and then we have a lot of resources for folks to create their own campaigns. We also have activities around online training for either public health professionals or community-based organizations, both online training that folks can complete at their convenience, and then also some live webinar trainings as well. We also are involved with some pilot projects, either through our partners or funding of pilot projects. So through our partnership with NACCHO, we will be funding some pilots that will partner health departments with community-based organizations. And then finally, we provide technical assistance. So health departments and CBOs are welcome to reach out to us if they have a particular question or a particular need around COVID-19 response among refugees, immigrants, and migrants. Next slide, please. Oh, and just a quick plug, our communications person would be upset if I did not plug our website. So here's our website and our email address. And then if you're active on social media, there's our Twitter and Facebook handle. And that does it. Thanks for the opportunity to share a little bit about our organization.
Yeah, of course. Thank you, Erin. So next, we're going to move into our panel discussion. So again, I will be turning off the screen sharing to allow you all to see the panelists as we discuss the importance of COVID community champions. So let me stop. So the first question that I have is for you, Janine. Could you tell us about a virtual or in-person community assessment strategy you've employed during COVID? What would you recommend as a promising practice during COVID for these assessments?
Definitely. I guess one of the, if we go all the way back to the beginning of COVID, one of the first things that we did, that was during the census. And we were doing, as I said, we were doing a lot of community outreach. And then, including, we had a 60 county bus in-person bus tour. We got through about six or seven of those stops, and we had to shut everything down. And then, we decided to, like everyone else, we pivoted to digital and virtual events. And we had television ads that were running. And one of the things that Rebecca DeHart, who's our CEO, and I decided to do, we were realizing that we thought, hey, people are at home, they'll be glued to their TVs because there's nothing else to do. But because we had our organizers who were still talking to people, still assessing the situation, still getting feedback from the community, we realized that people were focused. They were not focused on the census. They were not focused on television. And so we actually ended up pulling about $1 million TV ads. We ended up pulling all of that because we had to understand that these are real lives, and people were losing people left and right. They were afraid. And so we shifted, we pulled back, right? And we did our events, and we paid attention to the community before we started, sort of re-engaging with them. And of course, more recently, we're, in the middle of the, vaccine rollout. And you hear all of this, especially at the national level with communities, especially communities of color. And also, we've been in conversations. We work pretty closely with BAJI, the Black Alliance for Just Immigration, the Latino Community Fund in Georgia, and other partners. And so you hear all of this information out there, this narrative that people of color aren't getting vaccinated because of hesitancy. Well, we were talking to people. Our organizers are still out there making phone calls, talking to people. We've done surveys. And by having these conversations, by doing these surveys, we realized that it wasn't that, yes, there is hesitancy, but that's not the driving factor. The driving factor in a lot of the communities that we work in is that they didn't know how to get access to a vaccine. They didn't have access to information. And so they were getting misinformation from people about the vaccines. They didn't have transportation to get to a vaccination site. They didn't have, there were all of these gaps. And so instead of focusing on this idea that people are just hesitant and they're not going to do it, and sort of putting everything on them, we talked to the communities and learned, hey, here are the issues. And by doing that, that's why we started Count Me In, our Count Me In campaign. Our organizers have made over 74,000 phone calls to tell people, because we know that folks don't have access to the internet, especially in rural communities. We sent out, I think, over 600,000 text messages to across the state of Georgia. We've done calls where we have doctors and local elected officials come on, and people can, from the comfort of their home, ask questions live and get those answers. And so you really have to, the key to all of this is to listen to the communities. And so I think that works whether or not you're doing it for COVID or any other thing, any other emergency or any other process. You can't just tell people what you think they need. You have to listen to them and then work with them to come up with solutions that are community driven.
Thank you so much. That's so important to think about, especially as practitioners who are really have so many great intentions around getting community input. Shun, can you speak a little bit more specifically about text-based communications, how you reach already hard to reach audiences who may have limited digital access or digital literacy?
Yeah, I can. Again, thank you so much for having us here. And this is certainly a great question and relevant to our work at Fair Count. Janine has really articulated a lot of that at a higher level, because for us, we do work in really rural communities that often lack that technology infrastructure. And as she's articulated, their access often is quite limited. And in fact, it's something that I am very proud to say that Rebecca DeHart, our CEO, and Janine, our vice president, really focused on when Fair Count started. We implemented actually a technology assistance program. And I'm super proud of this program. It has allowed us to install computers and internet in more than 160 locations in just very rural parts of Georgia. And we started this program by partnering with the AME denomination. So of course, for me, the faith coordinator, I'm jumping for joy, but certainly because we knew pastors were trusted, faith leaders were trusted. So with that particular denomination, we installed 25 of those hubs in really rural communities with the premise that these would be technology hubs, which is what we refer to them as, and that they will really act as hubs for the entire community, not just the church. And it really has assisted us in reaching a lot of people that we probably could not reach. So we also, again, I want to just say very much backing up what Janine is saying, taking the time to see just what works in the communities that we serve and really doing our best to just kind of fold into what's already there. For instance, if I'm working with a church that doesn't have access, I get a better understanding of how they push out key information and find ways to just kind of mold into what they're already doing with their methods, which may be a phone tree or a mailer, or just, regular even snail mail if there is regular email if there is some access, but getting that understanding. And I'll also say for us, it's having the pleasure, especially on the faith end, of worshiping in a lot of these churches, whether it's conference call or, when it was in person for some of them, I'm in their Bible studies, in their church services. Again, just staying on the ground as much as we can to stay connected with them. And certainly on a larger level, Fair Count has done some extraordinary things. We did an amazing teletown hall a few weeks ago in a very small rural community to kick off a vaccine drive there. We also distribute toolkits, and we have an extraordinary field team. We're certainly not big in numbers, but I will say we are mighty. And we get out there in the communities, leaving door hangers and text banks, phone banks, just finding those those alternative ways when you're not able to do social media. But we're also doing it with the community, some of the volunteers, you know, always just being safe. We certainly understand the space that we're in. We do radio. We've done some billboards in key locations. Just again, always thinking about those communities that are often left out because of the lack of access. Attending community events to get the word out. Certainly more pre-pandemic, but I will say that we're slowly making our way back out there to do some limited in-person work. And we're just, you know, happy to be here, happy to be out there. We actually did we partnered with one of our Latinx churches last weekend because they reached out to us and wanted to do an event. We were able to partner with them on the back end of a first shot that they had done, and had a really just a super great turnout. Very excited to come together with them. And also, I would just say that we're vaccinated as a staff, which may be a little bit different in technology, but for us, that's relevant too, because we know that we can't support any of this unless we ourselves are vaccinated or doing the work ourselves. And just, again, just showing these communities that we serve that we're committed to them no matter what, and stressing that we're all in it together. So I would say that's just some of our things.
Thank you so much, Sean. I definitely understand that there is such a plethora of services that people are offering, and one thing that we've heard time and time again is one of the obstacles being how to build trust within immigrant and refugee communities. And so my next question is for Imam Wazir. Can you share any recommendations you would make to local nonprofits and governments looking to develop partnerships with faith leaders or institutions, as is demonstrated by Sean's answer around how that can be such a great entry point for practitioners and service providers? You're muted, Imam.
Thank you, George. Again, this pandemic is not a joke. It is a serious problem and require local, national, international collaboration across the board to combat these problems. What we have done at AIC, African and Immigrant Communities, is first recognize the magnitude of the problems. Second, collaborate across the board with everybody. Third, implement, act on it. Part of empowerment, we've done a lot of work first with IRC, work hand in hand to first remove the state of denial of the problem itself. So the people were not really 100% sure. They take some flu, some theory, it is, you know, conspiracy theory. This is done by China, by US, who knows? And they don't take that serious. So we have to empower, and then the vaccination to take, the importance of being vaccinated when vaccination was available. So we did in a number of language to the language that are spoken in our community across the country. So IRC was extremely helpful to convey those of my messages to millions of people around the country. We did it in Amharic, the official language of Ethiopia. We did it in Somali language. We did it in the Eritrean language. We did it in ethnic, other local language of Ethiopia, Harari, Oromo, and then in Arabic. So that, I think, was well received and disseminated throughout the communities in our country, in our communities. Then the second segment was also reluctancy of taking this shot during this holy month of Ramadan. Some think it will invalidate their fast because of the shot. As an imam, I came in the second round of message in collaboration with IRC, saying to the communities across the country and the world, this does not invalidate your fast by being getting the shot in your arm, religiously speaking. So that message was also went very well, and we continue to build the trust with our community, and they trust us. They worship with us. They pray with us. When they cry, we wipe off their tears. When their loved one die, we are with them. When their loved one get married, we are with them. With the day of sadness, with the day of happiness, we are there. And then working with the local communities. The Ethiopian community has its own organization and its own leadership, led by a very good friend of mine. Uh, and a number of members of our community are very active in the Ethiopian community as well, with the larger community at large, and then the Somali communities, and then the Arab communities, and then so many other small communities that we know each other. They know me by name. And my phone number is very easy for everybody. I made it on purpose easy. Even the elders doesn't have to write it. 404-944-4444. That's it. 404-944-4444. So every crisis you can think of, my phone is open 7/24 hours for any given problems. So made that available to them and helping to my best with my own limited resources, maximum helping out, working very closely with our mayor, Beverly. And whenever she have an issue or concern or message, she communicate with me. With Georgia State University, with Dr. Laster, we're working very hard, with Mary Holland, and with the chief of the police, with those even who are in prison. I go there and educate in prison as well, and deal with the crisis at prison as well. So we advise people not to violate certain things that lead them to go to jail. Then afterward, we deal with them. And then the health practitioner with the Department of Health, working hand in hand, attending their meeting and virtual. What we really need is additional resources. What I recommend is we need to have a hub of information sharing center. We need to have a hub, resource sharing center. FEMA is good, maybe under FEMA, maybe under CDC, need to have additional resources because we are the local, we know our problems. We are on the front line with our issues, with our people. Give us the tools to fight it. You do not send your soldier to the battlefield. You tell them, you know what? I give you the gun, but I don't have ammunition for you. It's not going to work. So we got to be fully empowered to do our job, to help the needy people. We need to fight hunger. We got to make sure there should be no single person hunger in the street of America and in the world perhaps. We should not see a single person who was a good living, waging, paying, receiving person be homeless because of this pandemic. We should not see our children commit suicide because of pandemic. We got to have social workers available to them. We got to have counselors available to them. To each school, the ratio of counselor and social worker is not enough. For 300 students, you only have one counselor. What does that mean? How's she gonna manage, or he gonna manage all this crisis of one counselor? You got to increase the number of the counselor. You got to increase of the social workers, case workers. You got to, because they deal with these problems. What we need is not only data. What we need is manpower on earth, on the ground, to go outreach to the communities that we serve. And then we got to have quarterly meeting, all the stakeholders, quarterly meeting, we need to come together. We need to share experience. For now, virtual. Hopefully down when everybody vaccinated, then we need to get in person. This pandemic, from what the experts are saying, is not gonna be over overnight on the next 6 months. Something that we need to think mid to long term, post-pandemic, we need to have those planning, be prepared now so that we can control and build this experience to pile it up for the next pandemic. Who knows what next is gonna come. So all this experience should not be evaporated, be on the the Library of Congress for the data purpose, sitting in the shelf. No, 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 no. We got to have it on the ground so that the people's life is impacted and change. Ultimate goal, what makes me happy is when I see a broken person lift up his head, lift up her head, and back on track, fastens the seat belt, hit the road to go work, go back to normal life, go to our daily life. Prior to pandemic is where we need to go, and that requires the collaboration of everybody. And the government also need to ease those restriction areas as this pandemic is improving. And we need to, particularly the reluctant community, in particular the Republican part. I'm not in the business of politics here. I'm not to try to politicize, but the previous administration injected the theory of this has nothing to do with the Republican per se. And great segment of our community who happen to be Republican are reluctant. And then still we have a huge number of immigrant community who still reluctant to take the vaccination. We need to target those and empower them with accurate information, with caring information, with loving for them, so that we might be the means to save their life. And the list goes on.
Thank you so much, Imam. One thing that really stood out is your comment around there needing to be kind of a central hub of resources, which brings me to the NRC RIM and Aaron, a lot of the work that you're all doing, and providing a plethora of helpful resources on your Vaccine Central website that are relevant specifically to our audience members today. What resources do you recommend people start with, whether it's generally or specifically in terms of resources about working with COVID community champions?
I would say first, increase the volume of the staff. We got to be able to hire case workers. You got to be able to hire social workers to give caring one-on-one counseling to the families and individuals. Those are essentially needed immediately. Second, we need to have emergency funding for transportation. For I like the president's proposal to the Congress. I hope they will approve his child care support to working mothers, so that that will not be, obstacle. If it's at the federal level that is authorized coming down to the community, then that will be helpful. So the mothers, the caring mothers, having their children at home and go to work, it's not going to work. So that would be help that are needed from the Fed down to local community. We still need rent assistance, for emergency rent assistance, so that people will not be evicted. We need to have jobs, back jobs, so people go back to work. So give that opportunity. We need to have information disseminated in multiple language, in multiple video clips to all the communities, so they can be maximum vaccinated. We need to have a tracking system. How many segments is still we lacking that we need to vaccinate? So CDC can play an instrument and deploy the manpower to monitor what segment of the community that are not vaccinated and why. Then deploy needed messengers to convince them to come on board. The vaccination is now available, so there should be no reason not to take it. So whatever that preventing them, tear that wall apart in a nice, gentle way till they convince them and empower them so they can make a sound decision. We cannot force. I'm not asking the government to mandate it, force it. The people have to have their freedom, but you need to empower them to get the information needed so they can make sound decision. And the list goes on.
Thank you so much,
One
Imam.
more thing, the media need to do really more work. The media now, in one hand, not only terrorizing the people, so the people, oh, they don't want to even watch the news anymore. No, no, no. The media also need to do the big segment of empowerment, what are available to the people, why they need to be vaccinated, special good programs to the people. That will be also the help of the media as well.
Yeah, of course. Aaron, what resources do you recommend people starting with on NRC RIM's Vaccine Central website?
Sure. Thanks for that question. And I echo what Imam Wazir said. I think those are some fantastic practical suggestions about things that need to be happening broadly. In terms of what we have at NRC RIM and Vaccine Central, sort of depending on where folks are at in terms of their needs, we've tried to develop a lot of really practical resources. So we have, for example, some guides and checklists about considerations when doing vaccine events among refugees, immigrants, and migrants. And this has come from about 60 different interviews that we've done with public health professionals, healthcare providers, and community leaders to figure out, what are the really important considerations when you're planning and communicating and holding a vaccine event. We also have a lot of materials about vaccine messaging. So we have a suite of campaign materials that we're translating into 38 different languages, and it's a set of fact sheets, social media messages, some video PSAs, audio PSAs. It's intended to for folks to take and put their own logos on. So everything is developed to be really customizable. So that's part of Vaccine Central. We have some promising practices. So some ideas that are coming from these interviews and from our partners, so learning about what's working in the field, highlighting everything from models of vaccine ambassadors to partnerships with faith-based organization, mobile vaccine sites, trying to just feature some of those really exciting successes from the field. I'll also mention that in addition to the Vaccine Central page, we also have a toolkit about community engagement. And I know other panelists have talked about, using these same approaches outside of COVID. And we're really excited to have a toolkit about community engagement that we think could be applicable beyond COVID. So everything from a checklist for health departments that maybe don't know quite where to start with a particular community, some suggestions for identifying community leaders, as well as things like focus group guides. How do you do a focus group with communities? Some more promising practices about creative community engagement activities. So depending on where folks are at, I think either Vaccine Central or the Community Engagement Toolkit would be a good place to start.
Thanks, Aaron. That kind of brings me back to one of the, we've heard a lot about how this process can be kind of simultaneous in trying to figure out building trust with your immigrant and refugee community members, as well as trying to figure out who exactly is in the community, what are the community needs that are being, that community members are facing. And so, Janine, my next question is for you around what recommendations you have to practitioners in tracking more than one metric or indicator with regard to COVID-related damages that communities are facing.
Definitely. So I mentioned earlier that, so we partnered with the Southern Economic Advancement Project and the National Conference on Citizenship, NCOC. So NCOC, since last year, they have a report called Pandemic to Prosperity, and I'll put it in the chat. But we partnered with them to do one specifically focused on communities in the South across 12 different states. And we look at different indicators. So of course, we're looking at COVID rates in communities and vaccination rates, but we're also looking at things that impact individuals. And we make sure that this information is available for folks. So we're looking at how the pandemic is impacting businesses, food security, the loss or the absence from schools. We're looking at how, especially in the South, we had not only COVID, but we also had one of the worst hurricane seasons that we've seen. So we look at the impact of disasters. Another thing, so this, and we provide this information, not just through the report, but we also provide the data so that community, if folks that want to know specifically what's going on in their state or their county, they can download these data and actually look at it. And the way that Fair Count uses it is that guides our strategies. So if we know that there are issues, or for instance, we knew that Georgia was consistently at the bottom for vaccination rates, of all 50 states. And so we acted on it. Our sister organization, SEEP, they're really policies. And what we're finding is that because we go out and look at the data, we're finding that there are data gaps and there's no real infrastructure. So how do we make sure that communities and local governments have a data infrastructure so that children don't fall through the cracks, so that they use the information to, come up with systems that can help, remediate some of the losses that we've seen on the educational front. When we look at food insecurity, that's why we work with organizations like Feeding the Valley a food bank that goes to, we partner with them not for, for our COVID shots, so we're partnering with them and actually having, starting, I think this weekend, Shun, we're going to start having CORE, which is a mobile, will be going out to food distribution sites so that individuals and families that are there to pick up food will also have the opportunity to get vaccinated while they're there. And so we use all of this information and these different metrics to really see what's going on and to drive all of our strategies. And so I would suggest that go on to Pandemic to Prosperity, just in general, I'll put it in there so you can see some of the information. But then to use that to really think about how do you use this to really help communities recover, help communities get vaccinated, help communities prosper, and just find the ones that are the metrics that are relevant to the communities that you work in.
Thank you so much. That actually really brings up the next kind of subtopic within that, with data gaps and infrastructure. And my next question is for you, Sean, around the ways that COVID champions or organizations, local governments, can utilize the existing efforts made for Census 2020 between faith leaders and hard to reach populations to strengthen inclusive emergency management and recovery, and kind of speak to what Janine had just brought up.
Sure, yeah, it's a great question. Before I really dive into it, I want to say that I'm absolutely happy to discuss those existing efforts, but I think it's really paramount to focus also on utilizing those existing relationships. And a lot of that is really sort of honing in on what the imam says, because I think that almost guides you. So we know that a lot of, obviously, as Janine has articulated, and we've kind of talked about today, that a lot of our things are spun out of the census, which, is really the foundation of what we do at Fair Count. But all of those things are also key to every programmatic shift that we do. Because what we found very often, similar to what the imam said, is that whenever you enter into a community, or whenever we've entered into a community, we see that those frontline contacts, which for us are going to be those community leaders, certainly in my case, the pastors of the community or the faith leaders of the community, that those people are at the front of every initiative that's going on, because they just remain at the front. So when we enter into any community, I'm going to say that first and foremost, we're always intentional, and just really taking that special time to understand as much as we can about that particular community. And again, that entails taking time, asking questions. We do one-on-ones when we go into these communities to really just get a sense of on the ground, or certainly in the space of COVID, as much of on the ground as we can get, to really just see what works specifically for that community, as opposed to Fair Count entering into a community assuming that we know what works. And I think that's really paramount. And this approach also, in my opinion, allows us to just forge stronger relationships. A lot of the things that Janine has mentioned, we find out maybe even before some of the data comes out, because we're just plugged in, and we stay super plugged in to all of our contacts, and really stress to them from day one that we're not a campaign. We are a nonpartisan organization that will work with anybody to make the community better for everybody that lives in it. So on the faith end, I would say, I would regard all of these things as strategies. I may start with a local pastor, and through that relationship, it's going to connect me with someone in the school system or a business owner, so that when we hit that next pivot, now I have someone else already in my sights, or I'm looking at a wider view. And again, this happens when there's trust, which is why we don't just reach out to community leaders. I don't just reach out to faith leaders. I worship with them, whether it's virtual, whether it's pre-pandemic, in person, because again, it just allows us to get just a better sense of, first of all, who is left out, and why they're left out, but also determine what's specific for them. For instance, why is this particular community hesitant as it relates to the vaccine? Now we're able to specifically address some of their issues, or now we can combat some of that misinformation because we're now working with them sort of as an individual community. And the bottom line is, when we connect with leaders that are already working with the people, it's easier for us to get to the people. And that just gives us better insight. And it allows us to just have better trust, because at the end of the day, it is that trust that allows us to organize the people so that programmatically we can fall back on all the successful strategies that we have from the census, but that we also had when we did voting and we did any other endeavor. So I think the takeaway for Fair Count is that we never unplug across any initiative that we have. Hopefully that answered it for you.
No, of course. I think it just brings up so much around the mechanisms that you use to really engage with community members, which I think helps local governments, local practitioners really create that opportunity and that loop for feedback for immigrant and refugee communities to be able to voice exactly what it is that they need. And like you said, not on the practitioner side, assume that a community needs this or this because you read about it, or that might be the assumption. And so one thing that I've noticed as well in that effort is how important language access and the ability to communicate across what language access is, the umbrella term language access, like digital literacy, digital access, which you kind of touched upon. And so my next question is for you, Erin, around how language access has become evidently clear need for individuals throughout the pandemic. And so what have you seen emerge as promising practices for making the case to state and local public agencies to invest in language access?
Yeah, thanks for that question. So as I mentioned, we did a bunch of interviews with public health professionals, healthcare providers, community leaders to understand what was working well and where there were opportunities for improvement with COVID response among refugees and immigrant communities. And almost every interview, language access came up over and over, whether it was access to materials or access to interpreters or bilingual staff during testing, contact tracing, or vaccine events. And I think what we're learning from COVID, and I think this is certainly obvious to folks that work in this field, is that language access really needs to be a consideration that's built into every step of the response and not something that is added on after the fact. For example, just in the context of contact tracing, something that we learned, and it sounds fairly simple and obvious, is the importance of collecting preferred language at testing sites and carrying that data point throughout the continuum of testing and case investigation and contact tracing. Because if you miss the opportunity to collect that preferred language information at the testing site, then when it comes time to do either a case investigation or a contact investigation, you really lose valuable time in terms of getting somebody connected to an interpreter to do that phone conversation. So that's an example that I think has come out over and over, and I'm hoping that will be sort of evidence and sort of a call to action to health departments and to others that we really need to think systematically about how do we build in both, again, the material access, but also the bilingual staff, the bicultural staff, and interpreters along the way.
Thank you so much. So my final question before we go into the Q&A is for Imam. So as someone who has really worked with the IRC in translating several messages to community members in multiple languages around the benefits of the COVID vaccine, some questions that we've received along the way is how to be a mindful COVID champion and how to communicate the benefits and kind of dispelling a lot of the myths that come along with with vaccines for immigrant community members who one may not have access, may not want to, or may have heard information that makes them fear the vaccine itself?
Thank you, George. Again, as I said on the first two clips that we did, first clips were to empower everybody to be vaccinated in their own language, from their own imam. It makes a difference like a day and night. So the second thing also, not to be reluctant again, not to take it in the month of Ramadan. Again, their imam is coming telling them in their own language. It makes a difference like a day and night. It's not to disrespect a white man, say, not a white man just come in and talk to them and do this and that. From their own person that speak their language, understand their culture, is telling them the same message the white man or the black man or the government man or the government woman tells them the same universal, consistent message. Now, the message will be swallowed and processed and act on it. A lot of our people have been vaccinated and continue to be vaccinated. The work is not even over. Why the pandemic is not over yet? So it's not something to relax and say it's over, that's it. We have a lot of work to do. Until we eliminate this pandemic, we will continue to fight all the way through to empower the people. We're using our local radios. We're using our religious platform. We're using our all social medias. We have a WhatsApp group. Hundreds of WhatsApp group is what the African and the immigrant community use, which men, Stream America, they don't use the WhatsApp. WhatsApp group is, it's an app on the phone. You can have a member up to 250. Each ethnic group, they have hundreds of them. So the same message clips, we feed it to each leadership of the community, and in return, they take it and disseminate it to every segment of the society within the immigrant and refugee community. It's very important. The Twitter, we're using those. We use whatever is available to us. So hopefully with that empowerment, it will change. Again, having the same additional resources to the local small communities for different grants or different programs to empower them to do their job, it will be a big help for them, because all of us, we have our full-time job. In addition to full-time job, we have taken this on our shoulders. That in itself is a full-time job. So if those will not be relieved us, so then you'll be the secretary, you will be the clerk, you will be the outreach, you will be the communicator. This is just too much. So those tasks need to be relieved so that we have manpower to help us to do. It's not only volunteer basis, we need to have paid staff, part-time, couple of different experts that speak their language. If we have those resources, it helps us a lot to fight this pandemic. And the data Janine and her organization are helping put together. And the work of Irene is extremely of cornerstone to fight this pandemic. Work hand in hand. The data is needed, yes. So that help us, okay, this is the number of thousands of people that we have, but we need to reach. How do we reach them? What do we need to do that? So in my crisis management in PowerPoint 2, that's what I talk about specifics. Planning, okay, how do you plan it? Who's doing what? By when? How many people are we targeting? Open-ended is not going to work with deadlines. So we then talking about eliminating these problems down the road. One thing is for sure, doing nothing is not a solution. Doing nothing is not a solution. Doing emotional response, people are, I summarize in 3 categories. First, I call them those who are doing nothing. They are part of the problem, actually. Those who are doing nothing to any given problems, they are part of the problems. Then I call them, there are two ERs, emotionally responsive. They emotionally respond and then they evaporate. Or emotionally what they respond may be outweigh the problem itself and generate more problem. That's the problem. I will go to number 3, which you and I and we need to be. 2 R's, responsively responsive. We need to feel responsible to the problems. We don't say this is a white problem. We don't say this is a black problem. We don't say this is a Muslim problem. We don't say this is a Christian problem. We don't say to this African. It is a problem. It is our problem. We need to own it. There is no better teacher than nature. Mother Nature, when it's rain, to rain everybody. When this kind of epidemic comes, it has no color. It has no gender. It kills everybody that come to the cross, whether you're a child, adult, black, white, Muslim, non-Muslim. The pandemic care less. So we have common enemy. This common enemy can be combated together. It's not by one family. It's not by one individual. It's not by one organization. It's not by one city. There are some collective collaborative work that are needed, then specifically to each community, to their particular need to be resources deployed and go to combat this enemy, that invisible enemies. So we can, at least with vaccination, we start to breathe. We start to go to gym. We start to go to our work. We start to back to worship, to the mosque. Last year, the holy month of Ramadan, we did it virtual. We could not go to the mosque. It was so serious. So now it's changed. We're still maintaining our distance. We still put our masks. We start to manage the crisis, but we need to eliminate it all the way together as we started. This good gain, if we relax, we're going to go back to square one again in no time. We cannot afford to do that. Thank you.
Thank you so much, Imam. I will be closing us out now. Thank you so much, everyone, for participating. Sean, Dr. Abrams-McLean, Aaron, Imam Wazir. On behalf of our attendees, I would really like to thank each of you for a great discussion. This session, as well as all of the other sessions being presented as part of the interactive, has been recorded, and you will be notified once all of the recordings are available, so you can access any sessions you may have missed, as well as listen to this session again. Be sure to share your learnings on social media using hashtag interactive2021, and please take a moment to go into Sched Agenda and leave your feedback on this and any other sessions you attend. This concludes Welcoming Interactive 2021. We hope you've gained new ideas, been inspired, and made some new connections. Thank you so much for sharing your valuable time with us, and we truly look forward to seeing you in person next year in Charlotte, North Carolina. I hope that everyone stays well, and thank you again so much for your time.